Hello, I'm Dr. Groover of Groover Clinic. Let me introduce you to the fundamentals of Groover Clinic and Groover Comprehensive Chiropractic. I'll start by defining the name of this healthcare innovation and speak about the significance of symptoms, primary and secondary joint conditions, joint structure and joint function, joint subluxations, and the spraining of ligaments which accompany joint subluxations. I also have some important information for you about the nature of pain. The term comprehensive in Groover Comprehensive Chiropractic originates from the Latin comprehendere, meaning to grasp mentally. The dictionary defines comprehensive as complete, including all or nearly all aspects of something. The word chiropractic in Groover Comprehensive Chiropractic is derived from the Greek word chiro, or hand, and from the associated words practikos and pratin, meaning practical and to do. Therefore, the roots of the term chiropractic mean done or practiced by hand. The dictionary defines chiropractic as a system of complementary medicine based on the diagnosis and manipulative treatment of misalignments of the joints, especially the spinal column, which are held to cause other disorders by affecting the nerves, muscles, and organs. The term Groover in Groover Comprehensive Chiropractic is, of course, my last name. Groover Clinic employs my philosophy, vision, way of diagnosing and treating people, and our clinical outcomes are distinct. Therefore, my name is used in Groover Comprehensive Chiropractic to identify the Groover Clinic way of practicing chiropractic and the successful results that we achieve. Groover Comprehensive Chiropractic is a systematic, sequential way of diagnosing, treating, and in most cases, eliminating or greatly reducing conditions such as acute and chronic pain, accidental injuries, sports injuries, stress and trauma, metabolic conditions, and for improving performance in sports, work, and recreation. Let's clear up any misunderstandings you might have about symptoms. The dictionary says a symptom is a physical or mental feature that is regarded as indicating a condition of disease, particularly such a feature that is apparent to the patient. The dictionary defines a feature as a distinctive attribute or aspect of something. Therefore, symptoms are not your actual medical condition, but are your experience of an aspect of your condition. Symptoms are certainly not the cause of medical conditions. Your symptoms arise after already having acquired a condition or disease. So if your condition or disease is not caused by its symptoms and the conditions or diseases do not cause themselves, then your condition or disease originates from a cause which occurs before you experience your symptoms and before the onset of your condition or disease. Our new patients usually discover that they have a condition because they experience symptoms such as pain, tingling, or numbness, stiffness, weakness, dizziness, vertigo, nausea, or high blood pressure. And of course, they want us to help get rid of their symptoms. These symptoms are often derived from joint conditions and associated muscular, neurological, and inflammatory disorders. Joints are formed where two or more bones meet, and joints have nerves which sense and transmit sensation, and nerves for controlling the muscles which move your joints. Primary joint conditions are those conditions directly associated with the structural and functional abnormalities of your joints. So, what do we mean by structural and functional abnormalities of your joints? Your joint structure is the arrangement and relationships between the two or more bones within the joint. In other words, your joint structure is your joint's alignment. Normally, your joint alignment is determined by how well the shapes of your bones fit together. Your joint's ability to stay in alignment is determined by the strength of your joint ligaments and the tone and strength of your joint stabilizer muscles. Your joint ligaments are short bands of tough, flexible, fibrous connective tissue that connect two bones or cartilages or hold together a joint. Your joint stabilizer muscles are muscles which contract to hold your joints together in proper alignment when your joint mover muscles move your joints, or when you load your joints against resistance, as when holding a heavy object. Your joint function is the way in which your joint works or operates. For instance, how flexible are your joints? Do they possess adequate range of motion and strength? And do they move with fluidity and comfort? Abnormal joint structure and function usually occur from joint subluxations. Joint subluxation is a term used in chiropractic identifying joint misalignments which are less than joint dislocations. Joint subluxations occur from acute and repetitive stress injuries. An acute subluxation injury is a joint misalignment from a direct and immediate trauma to the joint. For example, your neck vertebrae are usually subluxated when your head and neck are thrown backward and forward during a whiplash car accident. Your shoulder joints will tend to subluxate from landing hard on your shoulder after laying out and catching a pass or falling on your shoulder, snowboarding, or being thrown off a horse. Repetitive stress injuries occur over time from using your joints the same way over and over. For instance, tennis elbow and golfer's elbow are repetitive stress injuries from swinging tennis rackets and golf clubs. When acute and repetitive stress injuries push or pull your joints into subluxation, your joint ligaments are sprained. The encyclopedia says a sprain is an injury in a joint caused by the ligament being stretched beyond its own capacity. There are 3 classifications for sprains. A grade 1 sprain is defined as a mild damage to ligament or ligaments without instability of the affected joint. A grade 2 sprain is considered a partial tear of the ligament in which it is stretched to the point that it becomes loose. A grade 3 sprain is a complete tear of a ligament, causing instability in the affected joint. Subluxations and their accompanying sprains may or may not cause joint instability. The American Council on Exercise says joint stability is the ability to maintain or control joint movement or position. Joint stability is achieved by the coordinating actions of the joints, surrounding tissues, and the neuromuscular system. Joint instability is a lack of support in the joints, which puts a person at risk for the joints to become displaced or dislocated, leading to injury. Acute joint subluxations and their accompanying sprains trigger nerve compression or nerve stretching, muscle contractions and spasms, problems with muscle deactivation, muscle weakness and poor coordination of movement, impaired circulation, inflammation, pain, and degenerative joint disease. The onset of joint subluxations from repetitive stress injury is subtle in comparison to acute subluxations, but the long-term degenerative effect is the same. Pain occurring from a joint subluxation is a symptom, not a condition. The pain is the effect and not the cause of this joint disease. Because your pain is secondary, meaning caused by your joint subluxation, it is called a secondary condition. Your pain may be focused, diffuse, or radiating, involving your joints, muscles, and nerves. You may experience accompanying tingling, numbness, or stiffness, problems with muscle weakness, deficient muscle activation and coordination, impaired balance, or generalized difficulties with posture and your movement. Subluxation of your joints will often initiate a sequence of primary and remote secondary and even more remote tertiary conditions such as poor posture, nervousness, tension, anxiety, depression, fatigue, and exhaustion, post-traumatic stress, high blood pressure, fibromyalgia, shallow or restricted breathing, poor hydration, difficulty sleeping, digestive problems, weakness and stiffness of movement. Now you've been introduced to the fundamentals of Groover Clinic and Groover Comprehensive Chiropractic. You've heard about the progression of symptoms, conditions, and causes, joint structure and function, alignment and stability, and joint symptoms and conditions. Stay tuned for our next video for information about the distinctions between healthcare and wellness care and disease care. To attend a free global functional screening evaluation, call Groover Clinic at 303-442-7772. Email us at info@grooverclinic.com. Find us on the web at www.grooverclinic.com. Follow Groover Clinic on Facebook, Twitter, Google+, and YouTube.